leads.
You said something in your explanation now that, people feel that addiction is all about getting high, but it's all about survival. What exactly do you mean?
So we often associate, and this is one of the biggest myth about addiction, is that when people want to get addicted because they want to experience that happy high state, maybe sometimes temporarily, but people who are struggling for a long time with the problem of addiction, it's not just about getting high. They've reached that threshold of getting high. It's about that survival, or it's about getting that dopamine kick, or it's about meeting their unmet emotional needs. It's about feeling that, okay, when I am using this substance, nothing can go wrong. It's their way to survive. It's their way to feel seen. It's their way to feel validated. It's their way to feel that they are in control of something. That's why I say it's about survival for them, not just getting high.
In your experience, dealing with people that are actually addicted, how much of addiction is habit versus craving?
I would say, being a practitioner, it's more of an habit. It's a compulsion.
Why would you say that?
Yeah, I would say that because it's scientifically proven, and more importantly, as I mentioned before, it's not something you choose, you get pulled into it. So that's why it's a behavior pattern. Like, let's again, you have breakfast at a particular time in the day, right? Even though you don't want to, you have let's say a meeting, but you have that craving, right?
Yeah.
You think it's a craving. No, it's a habit. You were forced, or you were conditioned to eat breakfast in a particular time of the day. That's why you have that craving. So anything you do, it's conditioned. It's your behavior that puts you into that routine.
Hello everyone, and welcome back to another episode of Fuse. In today's episode, we are peeling back the layers of addiction, not just to look at what people are addicted to, but why. Why do we reach for certain habits when we are lonely, angry, afraid, or just numb? Why does relief feel like a reward even when it's destroying us? And what does it really take behaviorally and emotionally to break free? Addiction is not weakness, it's a language, and today we are learning how to translate it. Whether you have battled addiction yourself, love someone who has, or just want to understand the human side of this struggle, this episode is actually for you. To discuss this topic, our guest is Dr. Diya Ganguly Mallick. Dr. Diya is a distinguished chartered psychologist, seasoned academic, and corporate trainer with over a decade of clinical and consulting experience across the UK, Middle East, and South Asia. A gold medalist and award-winning facilitator, Dr. Diya is widely recognized for her work in psychology, emotional intelligence, and behavioral health transformation. She's known for her dynamic training style, incorporating interactive exercises, case studies, and real-world examples to create engaging learning experiences. Dr. Diya has worked extensively with high-functioning individuals, treatment-resistant cases, and clients with co-occurring addiction and behavioral disorders, delivering tailored interventions that blend neuroscience, psychometrics, and trauma-informed care. Her work spans across private rehab centers, community mental health services, and executive wellness programs across the UAE, Maldives, and the UK. So, ladies and gentlemen, welcome Dr. Diya. Hi, Dr. Diya. How you doing?
I'm very well. Thanks, Ken, for having me, and hi to all your viewers and listeners.
Thank you. Welcome to the show. So, how does it feel to be here?
Great. It's souring outside, but I'm loving the energy inside your podcasting studio. Hopefully, you're going to have an amazing podcast show together.
Of course. When we looked at this topic, because this topic is actually very dear to my heart, because, I grew up in a city where I saw a lot of addicts. I grew up in a place where I saw people ruin their lives because of substances, because of things that they were involved in. So when I'm going to talk about this, it was really emotional for me. So I just hope I'm going to have a very fantastic conversation, And when I look at your antecedent or your profile, it speaks volume. as to how you've been able to, work so hard in, help, solve this problem, I would say, or help people navigate this struggle. So I want to ask, what exactly drew you to this profession?
Right. Um, to be honest, I've always been fascinated about human behavior and human brain.
Okay.
And I've always felt like there's so much we can unravel. We know a lot about human behavior, but there's so much more to unravel. But to go back to your question, what actually drew me in, I have to go back to my childhood and tell you a little story which actually fascinated me, or I would say pushed me to come to this profession, where
Okay.
I had a lovely neighbor, very well to do. It kind of resonates with the story you were just telling me. You come from a city. So I actually came from a place where there was not, I wouldn't say it kind of was grappling with the problem of addiction, but we had a lovely neighbor who was very well to do, very sophisticated, well read, and he lost his family due to an accident. And in a couple of months we saw him getting addicted to substances, and he wouldn't come out. He would withdraw from friends, family, community. And in a couple of months, he lost his job. And in a couple of months down the line, we actually lost him. And as a young child, I was probably 11 or 12 years old that time, I couldn't, grapple with that truth, that how could someone who would, swing balls at us or toffee at us, change so much, and we could lose him in a year's time because of an emotional tragedy he had in his life. And I was very curious to find out, how did we fail him as neighbors, as community? And that kind of, pushed me to come and, into the field of psychology. And over the years, through my clinical practice or research, I've found myself coming back again and again into the field of resilience, trauma, behavior transformation. And I have seen people, how they have struggled, but also have managed to rebuild their life in extraordinary ways by using psychology, neuroplasticity, and some of the right environment and tools we provide them. So if you really ask me, yes, that incident in my childhood, touched a chord in my heart to do something for community. But even when I grew up as an adult, I really enjoy what I do, because I think I make a difference, not on a personal level, but on a broader level, by helping people to understand why they behave the way they do.
Amazing. Listening to you, I could actually feel that passion, that enthusiasm in the work that you do. And if I also want to look at what you do, might want to actually, know, was that a personal or professional moment that made this job or this profession meaningful to you?
I think it's a combination of both. You need to be interested personally. There has to be a personal motivation to drive you every morning to get out of bed and go to a workplace where anyone can enter your door with any kind of problem or challenges. So you have to have a personal mission or a purpose to be in this field, at least to survive for a long time. And professionally, yes, I think the beauty is there's no one size fits approach for any case of addiction or any mental health challenges I deal with. What you read in books, yes, it's helpful, but it's always different. You have to customize depending on the problem, the challenge, the severity, or the frequency of the case you have in hand. So I think it's a combination of both. You have to be professionally driven, but there has to be a personal passion to do something good for the community, to do something good for the people who are struggling.
So, which particular moment was meaningful for you or has been meaningful to you throughout your career?
I think when I first resolved my case, because when you are into this field, you realize that what you study in books are not always applicable. It's a constant mix of learning, changing, tweaking, and finally finding a solution. So I was trying to help a very young person who was grappling with the problem of addiction. So that was my first case. And I was trying CBT, all the traditional methods. But what I understood is, if I really need to help the person, I cannot just treat addiction as a behavior. I have to treat the deeper wounds associated with it. And sometimes addiction is just an emotional solution to emotional pain. And that was a very, I would say, defining moment of my life where I could understand that working in this field is not just about treating surface level problems or behavior, it's about treating deeper wounds. And that, I guess, was the moment I realized that I need to be in this profession, or I love what I do, because I am not helping a person just to treat a surface level symptom, but probably helping them to rewire their brain, reprogram their brain, and rebuild their life in extraordinary ways.
Amazing. And in course of your explanation, you said, the cause of addiction could be traced to, deep emotional wounds. And from your experience or your experiences, what would you say these wounds are?
Very interesting question, and I'm glad we're addressing this. It could be any emotional wound, and it can start from a very young age. Let's say you are growing up in a family environment that is neglectful, not even emotionally abusive, but just neglectful, doesn't validate your emotion. That could cause trauma. Or when there is repetitive shaming in the family, or in school, or in neighborhood, that could also cause trauma. So these deeper wounds could be related to either constant shaming or any trauma you have experienced as a child. And remember, when I talk about trauma, you have to understand trauma doesn't just happen to us, it's inside us. It stays, it remains inside us. So that is why, if you don't deal with that trauma, your brain will only look for survival. Your nervous system is always on high alert. You are always on that flight and fight mode. So your brain will not look for those pleasant connection, those friendship, intimacy. It will only rewire for survival. And in order to get relief from that internal chaos that you go through in your mind, a lot of people resort to addiction just to soothe their emotional pain, or deep-seated trauma, or those emotional scars. So you see, everything is connected. We think, okay, people just get up and get addicted, and they might lack purpose in life. No, most of the addiction stems from deep-seated wounds or long-lasting traumas.
This is quite revealing for me because, I grew up in a city where, like I did tell you, I saw kids addicted to substances, and it was quite, would I say, terrifying? I think that's the word. And I'm actually very grateful to God I got out of that environment very early, and because I don't know what my life would have been if I was still in that environment at the time. But let's look at this subject deeply. So how would you describe addiction from a behavioral psychology perspective?
Right. To simplify, addiction is compulsion, which is repetitive behavior and lack of control. It's not something you're born with. It's acquired, it's learned, but so is recovery.
Why do we learn this behavior?
Yes. You learn this because you could be experiencing trauma, you could be experiencing volatile, emotionally charged environment, or you could be experiencing constant shaming. You learn this because what's normal for you seems to be painful. You learn this because that's your temporary escape from reality. You learn this because your brain is tired of coping with the emotional pain challenges you're facing. So that's why, your brain craves from escape. It craves from comfort. It craves for survival. And when your brain craves for survival, it usually finds survival in addiction. And when I say addiction, it's not just about substances like drugs and alcohol. It could be games, it could be shopping, it could be work. So it gets addicted to something which gives them that control, that temporary relief, which makes them feel that, yes, this is what I'm good at, and they forget the other facets or the other things in life. So that is why it's important to understand that addiction is not just reliance on substance, it's a repetitive or recurrent behavior or compulsion and lack of control. And we get into this because we are looking for that temporary escape from reality, which is painful, emotionally volatile, or which doesn't see you, acknowledge you, or you even understand your feelings.
From your explanation, it's quite informative because I realize also from my research and my experiences that people resort to addiction or to substances for a temporary relief.
Yes.
At the end of the day, reality still checks in, right?
Yeah.
But let's look at what happens to the brain during
Yes.
addiction. What really happens to the brain during addiction?
Again, a very interesting question. You have to understand, first of all, addiction is a neuroadaptive process. That means this is your brain's way to cope with the pain you're experiencing. And when your brain is constantly in that coping mode, or in that, it kind of triggers your nervous system, it kind of sends your nervous system in high alert, and it puts you in a flight and fight mode. So you're never in that rest mode. You're always fighting, you're always trying to escape from the situation. And that is where the problem, I think, starts becoming more difficult to treat, because it's like a vicious loop. You keep
Okay.
coming back to it, you feel like you're stuck. And as community, we have always been not curious about the problem like you are curious and asking me through your research. It's more about disconnecting them, or shaming them.
Isolation, maybe.
Yes, yes. But you have to understand, we don't recover in isolation or in silos, we recover in tribes. So, if, let's say, you find someone with addiction problem, and if the natural tendency, which is unfortunately in most places, to kind of cut them off, set harsh limits, and push them away from society, people will only find those problems getting bigger and more challenging for them. So that is why, just to answer to your question, I feel, what happens to your brain is, your brain is constantly in that flight and fight mode.
Okay.
It releases, the cortisol levels, which is your stress hormones, and it impacts different parts of your brain. Same as, like, if when somebody shames you, the part that gets activated, the same path is activated when somebody shames you because of addiction. And you have to understand, when that part of the brain gets activated, you stop learning, you stop having the willpower to change. So see, it sets a chain reaction. It also kind of impacts your prefrontal cortex, which is responsible for your executive functioning, which is problem solving, reasoning, creative thinking. So that part also stops working, unfortunately, or it shuts down. So see, when you have a problem with addiction, somebody starts shaming you for that problem, you're a part of that brain which is responsible for physical pain gets activated. So you stop learning, observing new information. That's why you're not able to change. That's why you're not able to move forward. That's why also it affects your executive decision making process, or your prefrontal cortex, which is responsible for your day-to-day reasoning, problem solving abilities. And last but not the least, it also affects your frontal lobe, which is responsible for your cognitive flexibility and emotional stability. So you're not able to regulate your emotions. So you keep going back to your substances or the thing you're addicted again and again. You don't have cognitive flexibility. You're stuck in that moment. So I would say all part of the brain, which is responsible for productive functioning, creativity, problem solving, gets addicted somehow when you fall for addiction.
So it's safe to say that for someone that's struggling with addiction, the person will be less productive.
Absolutely, because it's a neuroadaptive process. It's biological.
Okay.
You biologically, you're not in a frame of mind to be productive. That's why, even though you want to, you struggle without right environment and support, you won't be able to come out of it.
This is quite tortured for me because we have a lot of people, that struggle with this, close to us, people we love, people we see on a daily basis. And they tend to struggle with this and they need help. And I hope that they are watching this and they'll get the help they need. But let's look at, addiction. Is there a meaning found in the pain of addiction? Is there a meaning to that pain?
I won't say there's a meaning, but a lot of people interpret as, this is a solution to their emotional pain, which unfortunately is not. Okay? Because for a lot of people, they get stuck into the feeling that, or this negative thought that my life is over, I have nothing to prove, I don't know what to do anymore. And this is the meaning, the internal thought or the internal psyche they create for themselves.
Okay.
And that has a chain reaction. In fact, I would like to, talk about a very profound research that was done by an award-winning neuroscientist, Dr. Kendall, on this subject, who actually worked on sea slugs or snails to kind of understand how our brain functions. And he found out, so his research focused on the neurobiological mechanisms of learning and memory. And he did a lot of work in neuroplasticity. And one of the insight from his research was, if you tell your brain, something repetitively, constantly, your brain will rewire, your brain will restructure. Now, let's say if someone who is addicted constantly keeps telling himself or herself that I'm worthless, there's no point of living, or I cannot get out of this problem anymore, your brain will actually form a new neural pathway believing that thought. It will become a part of your normal thinking and you won't be able to move forward. But let's say we have someone, another case B, who is trying to recover from that problem and keeps saying, yes, I am having this problem, but I've help available, I've access to right people who can help me, I can change, I can come out. Your brain will actually set chain reactions and you will be able to come out of the problem, because according to Dr. Kendall's research, our brain is dynamic, it's not static.
How
it's
dynamic is the brain?
it's programmable. It shapes in a way, I mean, whatever you choose to focus on, your brain will program in that way. So if you focus on I'm bad, I'm worthless, I can't do it, your brain will form that neural pathway and will put you towards that direction of actions. But if you're someone who keeps saying positive words or focused on healing and recovery, your brain will change, it will rewire, reprogram in couple of days, in let's say as less as 21 days, and it will set that chain reaction. You will see you're able to get out of bed, take the help you want and move forward in life. And it's been proven, over decades. And after Kendall's, there's another beautiful research, I think, done by Robert Waldman and Mark Andrew, if I correctly remember. They actually did a research on positive words or impact of positive words on brain. And what came out from the research, that if you use words like peace, love, we often see peace, bro,
Yeah.
let's spread love and hope, and we don't understand the importance of it. We always tend to go with the phonetics, but what you feed your brain is not just the sounds and phonetics, it's a neurobiochemical instruction you give to your brain. And I'm only saying this because not only this research, but the multiple research have proved that when you say positive words for a couple of times, and even if you just see it, it activates the part of your brain which is responsible for your problem solving, your decision making. And if you repeat that, let's say for a couple of times in a day, and that's why we talk about affirmation so much in our practice, it will actually help you to kind of strengthen your frontal lobe, which is again responsible for your emotional regulation. And this together again helps you to kind of get out of this problem. So that is why please be conscious of what are you feeding your brain, whether you're addicted or you're going through any mental health challenges or going through a tough time in life. If you keep telling yourself there's no hope, there is no peace, I'm not going to come off of it, you will never come out of it, because psychosomatically you're in that mental frame of mind where you have conditioned your brain not to come out of it.
So basically, if you want to trace addiction or whatever mental health problem, one could say that it's as a result of how we think or our mindset.
Yes, you have to understand that we have an internal world and an external world. An internal world is our thoughts. Everything that you think will get manifested in terms of your energy and action into your external world. So that's why you have to understand, what are you thinking, what are your thoughts, what are your normal thoughts. So if your normal thought is it's okay to get addicted, it's okay to feel pain, it's okay to have that trauma, you're normalizing that, and you will experience that trauma again and again from different people, from different stage of your life, because you have normalized that. So that is why it's important to understand, that when it comes to our mind, we have a conscious mind, we have a subconscious mind, or we have an internal world and we have an external world. Whatever you manifest, whatever you tell your brain, whatever thoughts you have, that will be the product of your action.
Amazing. I just feel like I'm actually in the lecture room right now, getting very serious, lectures and stuff. But let's look at, addiction more on this episode today. Now, someone might want to really check or really wonder, are there, behavioral patterns to addiction, and what role do they play in the development of addiction?
Okay, when we talk about behavioral patterns, first and foremost, we have to understand that there's lack of self hygiene. That's first thing that you can notice in somebody, who are dealing with the problem of addiction. Whether it's not taking shower, very simple things, forgetting to brush their teeth. That's the first thing that's visible and noticeable. You might not see the trauma beneath that, the deep seated scars, but these are some of the behavioral, I would say, indicators or patterns that is clearly visible. Lack of self hygiene. Second is social withdrawal, whether from friends, family. That's why a lot of people, don't turn up for work, high absenteeism, you will see in their profile. So that's another thing, social withdrawal is another common behavioral indicator that is associated with addiction. The other thing you might also see is that their obsession with compulsion, like, they want to do that. And it's not, we often see that, or relate addiction with being high, but it's not about being high. It's about survival. So that's the thing. I think if you really go deep down, you'll see that any case of addiction, it's all about trying to cope with their unmet emotional needs or psychological needs. So these are the common patterns, social withdrawal, lack in their social hygiene routines, and most importantly, trying to cope with their unmet psychological or emotional needs.
You said something in your explanation now that people feel that addiction is all about getting high, but it's all about survival. What exactly do you mean?
Yeah. So we often associate, and this is one of the biggest myth about addiction, is that when people want to get addicted because they want to experience that happy high state, maybe sometimes temporarily, but people who are struggling for a long time with the problem of addiction, it's not just about getting high. They've reached that threshold of getting high. It's about that survival, or it's about getting that dopamine kick, or it's about meeting their unmet emotional needs. It's about feeling that, okay, when I am using this substance, nothing can go wrong. It's their way to survive. It's their way to feel seen. It's their way to feel validated. It's their way to feel that they are in control of something. That's why I say it's about survival for them, not just getting high.
I could partly agree with this because I think growing up as a teenager in Nigeria back then, I think that was in my university days, I had, will I say, an acquaintance, okay, and then if he doesn't take any substance, he wouldn't show up to school. Like, he'll tell me, Ken, like, I must be on one or two things, to be able to feel myself.
Yeah.
And now I understand it's all about survival for them.
Yeah.
Someone that's actually addicted, at some point, needs that substance to survive.
Yeah. It's, nobody chooses to get addicted to something. It's not like you wouldn't choose to get a cancer or diabetes. It's the same thing. We often associate addiction with choice or with lack of willpower or whatever, but it's not a choice. It's more about your brain trying to cope with your unmet emotional needs. Your brain's way to find something normal, find something that they belong to. So that's why I say it's more about coping, it's more about survival. It's not just about, getting high.
And I hope someone watching this right now is taking notes and knowing that, okay, it's not about just getting high. It's about survival, but you have to take a different route to survival,
Yes.
not those substances. But let's look at, still this behavioral pattern. How long does it take to typically shift away from this behavioral pattern?
It actually depends on what stage of addiction, because somebody could be borderline addicted, somebody could be, severely addicted to a substance. So
Okay.
we cannot put a number. It again varies from an individual to individual depending on their case, depending on the severity and the frequency of the substance they're using. So it depends from one individual to another. But if you roughly or want a ballpark number, it's a time taking process, because when you are treating someone with addiction, You treat not just the biology of the brain, which needs to be rewired, you also deal with the psychology of their trauma, which again, where comes the survival part, and also the social context of the person. Because some families might be supportive and some might just use the concept of tough love, cut them away, set, um, very difficult standards for them to cope. So there's multiple contributing factors when it comes to treatment and recovery process.
You said something very important here. When our families discover that, a person is actually addicted to any substance or any maybe habit or something, there's usually this toughness,
Yeah.
this strictness. Does that really help?
No, because as I mentioned before, we do not recover in silos or isolation, we recover in tribes. So if someone feels that connection from the family, that healthy relationship, that support from family, they're much likely to recover faster or better, or their recovery will be more long lasting than someone who has no support. So that's why, when we talk about treatment or recovery process, we always focus on compassion and connection. And in all my treatment approaches, that's something I focus on. Because if you don't get that compassion, that validation, that acknowledgement from your family or friends, you will not find it a you will not find meaningful. So with addiction, there's always an emotional side. Remember, I was mentioning there's addiction is often an emotional solution to emotional pain. So if you don't have that emotional support from
Yeah.
the people you love, from the people you want to get that validation, it won't be long lasting. That's why people relapse so much, because they treat the behavioral symptom, but they
Okay.
don't treat the deep seated wounds. And in order to treat that, family needs to play a part, schools need to play a part, university, employers in future needs to play a part, whole everybody in community needs to play their part.
Amazing. And while we look at these subjects, one might actually want to know there are a lot of consequences to addiction, but why is addiction really dangerous or harmful? Can
For
you tell us
multi-
why?
yeah, for multiple reasons. A, it takes your livelihood out. I mean, if you get addicted to a substance, it's a compulsion behavior. You can lose track of time, you can lose track of your passion, aspiration, and it will take you away from your loved ones socially, because you'll start withdrawing them because you're so obsessed with a substance or obsessed with something you're addicted to. Secondly, it can hit your professional life in terms of job. As I said, when you are addicted to something, a part of your brain which is responsible for executive functioning or problem solving, decision making, doing a task properly, which we all need to do. Like we're doing a podcast, we have to
Yeah.
think constantly. Like you have to ask me a question, I have to answer. That's executive functioning.
Yeah.
That part of the brain shuts down. That's part of the brain, stops being productive or functioning effectively. So that is why you see challenges in your professional life. So yeah, professionally it takes a hit, socially it takes a hit, and there's also a lot of cultural taboo or stigma about this, and that's another thing that I would like to point out here. Because of this high cultural taboos or stigma related to addiction, people experience a lot of shame, a lot of guilt, and that what again pushes them to use their substance more. So what happens is that it's like a vicious loop. There's you don't find a way or reason to come out. So that's why you avoid people more, you avoid friends more, you feel there's nobody to help, and you don't want to get help. You kind of put yourself in a shell and you suffer in silos.
In your experience, dealing with people that are actually addicted, how much of addiction is habit versus craving?
I would say, being a practitioner, it's more of an habit. It's a compulsion.
Why would
You
you
know?
say that?
Yeah. I would say that because it's scientifically proven. And more importantly, as I mentioned before, it's not something you choose, you get pulled into it. So that's why it's a behavior pattern. Like, let's again, you have breakfast at a particular time in the day, right? Even though you don't want to, you have let's say a meeting, but you have that craving, right?
Yeah.
You think it's a craving, no, it's a habit. You were forced or you were conditioned to eat breakfast in a particular time of the day. That's why you have that craving. So anything you do, it's conditioned. It's it's your behavior that puts you into that routine. So it could start off as a craving, but it will only last if it becomes a permanent part of you through your habit. So I would say that it's more of an habit than just a craving.
Amazing. Also, in your experience, what's harder for someone battling with addiction? Is it, the addiction itself or who they became because of addiction?
I think it's more to do with who they became because of addiction. Because that I sometimes you'll see the two different people before addiction and after addiction. Their personality changes, their vibe changes, the way they talk, they communicate, their communication style changes. You see a very different person, and sometimes the person doesn't even realize the kind of changes that they're dealing with, not in terms of just their symptoms or behavior, but in terms of how they're perceived by other people. And because you're so stuck with that problem, you're not able to process, you're not able to sense how others are feeling around you. And it could be a very difficult experience for someone, their families or someone they love, because they have seen that drastic shift. That's why you'll see multiple cases where it's difficult for family to accept that this person have changed so much because of addiction, especially for young people. They used to do good in school, they're good in sports, but all of a sudden, because of an addiction, they don't want to come out of their room. They don't want to talk to their families. They become eccentric, abusive, verbally aggressive. It's always about who they become. That's what we need to deal with. Because if you only focus on the problem, the addiction, you're just seeing the behavioral side of it. We are ignoring the whole picture if you don't see how it has impacted them socially, psychologically, emotionally.
Okay. Now, while we look at this subject, to be very honest, because I would take us back to, my growing up, my childhood in the city of Port Harcourt in Nigeria. I would always refer to that city because that city, shaped me to the man I am today, regardless of where I am. And I grew up in a city where there's this peer pressure, like there are certain things you cannot do if you're not to feel among. All right. And I also realized that's the reason why a lot of young people, take these substances, get to cultivate these very terrific habits.
Yeah.
To that young person watching this right now in the university, in the streets of Africa, the streets of, any part of the world they are right now, and is feeling that peer pressure, what would you say?
I would say it's normal to feel that pressure, and because of that peer pressure, you feel that you have to do social experimentation with different substances. And social media is also a big factor there, you see your peers they're doing fine, and you get, pressurized into getting into that. But remember, nothing good comes out of this. To every young person, all I want to say, yes, you want to feel that happy high or that temporary escape. You want to do it once. Only do it if you feel you have the capability to step back. If you have the willpower not to get, addicted to it. If you don't,
Dr. Dia, this is very important.
yeah.
Oftentimes, I've seen people say, I'll just take it once. I can step back. Is that ever a stepping back when you actually start?
Well, a lot of young people do it as part of their peer pressure or social experimentation. And some people, trust me, have that willpower to step back, but most don't. So that is why you need to be very mindful. Like, if you feel that you are someone who is not assertive, who cannot set boundaries, who cannot say no, you should stay away from those substances, because it's more likely you will fall for it again. So it's again on your mindset, on your willpower to say no, to stay away. And yes, if I understand there's peer pressure, you want to feel that sense of belonging into a group, but there are other ways to feel that sense of belongingness rather than just getting addicted to a substance. Because if you get addicted, you have to understand, like, you will not only jeopardize your future, but also your present, by not being able to experience the other joys in life that a young person should experience, which could be, making meaningful connection, making, meaningful decisions as a young person, enjoying
Yeah.
that freedom. So I believe, what you're asking is, it's a very tricky question. Um, Only step into this if you feel you're assertive, you are strong headed enough to say no next time to a peer who is pushing you again to do that substance.
When I look at this particular angle to this topic, the willpower, for me, I think we have, as humans, we have the power of choice.
Yeah.
But again, I also feel that as humans, our bodies sometimes can be very tricky,
Yes.
So I would say
Yeah.
total abstinence.
Yes.
I would say, but I know how it is today in today's world. Social
Yeah.
media, peer
Yeah.
pressure,
Yeah.
parties.
Yeah.
You just bump into a party
Yeah.
and they
Yeah.
tell you just try
Yeah.
this.
Yeah.
It's just a one time, and the one time becomes the beginning of a very terrible life for you.
Yes.
So I would say you walk up somewhere, you
Yeah.
meet somebody, and they
Yeah.
give you a substance or they introduce something. Just say no, because the power of saying no is very powerful.
Yes.
The ability to say no.
Yeah.
For me, it has helped me a lot. I'm talking to you now because I was able to say no to certain things. I was able to tell myself, no, these are my limits. I won't do this. So
Yeah.
you watching this right now, an adult, a young person, I think you should cultivate that habit of saying a capital no, actually.
Yes, it's very powerful. It sets you apart. You don't just fit, you stand apart. And you actually inspire, a lot of your peers or even young people who struggle to say no. It's a beautiful skill to have, to say no, to set your limits and stand apart.
Amazing. Now let's look at addiction as well. Sometimes when these people take these substances, they have to justify it, right?
Yes.
So what are those lies they tell themselves to justify addiction?
I cannot live without it. That's the first thing. That's the only thing that helps me to be happy. So there's multiple excuses or justifications they can give, because at the end of the day you have to understand that, deep down it's their way to kind of meet their unmet emotional needs. So anything under the sun, seems logical or just justified to them to do the substance. So some of the common, justifications I've had over, throughout my career is, that's the only thing that makes me happy. That's the only thing that keeps me alive. That's the only thing that makes me feel pumped,
Energetic.
energetic, right? But they've never explored other substances. I mean, when I say substances, I don't mean the the addictive substances, the other things in life, which could be travel, networking, reading a book or meditating or affirmation. They've never had access to all those things that can also bring similar kind of joy, that can also trigger part of that brain which gives you that dopamine rush or that dopamine kick. They've never experienced those things in their life. So that is why they keep telling these lies or giving these justifications, because they have never experienced anything other than addiction to keep themselves happy. Again, I always encourage them, understand your addiction is a behavior, and you're having this behavior because you're trying to meet your unmet emotional needs stemming from childhood or trauma, any shaming you've gone through. So if you get a meaningful relationship, if you get a mentor, if you get a family who's supportive, you will get those joys from those people. You don't have to rely on a substance.
Amazing. And while we look at this topic as well, let's look at triggers.
Yes.
For me, I believe there's a trigger to everything.
Yes.
I believe so. So what are these triggers that, these people go through every day that feeds their addiction?
Again, there are multiple contributing factors, or when you talk about triggers, it could be simply being in a bad stage of life, a bad phase or a bad day. Like you think, okay, you're making progress, things are going well, but let's say you hear a sudden shocking noise or you experience grief or loss in family, you'll be more triggered to do it. Another thing is shame. Okay, you're trying your best, but you're still getting shamed by your partner or by your family members. You'll be triggered to do it again. Uh, Also could be lack of purpose. You feel okay, you're trying, but nobody's seeing that progress, nobody's helping you, or nobody's listening. You don't feel seen or validated. That will be another trigger as well. So always remember, there could be multiple triggers, but the most common ones are when you feel not seen, when you feel unsafe, and when you feel there's lack of compassion from people you love and care. You'll be more triggered to go back to your addictive behaviors.
Okay, now, so when someone is, seeing or witnessing these triggers, all right, what approach would you say it's best for them, especially when they feel the best thing to do when they encounter these triggers is to get addicted to something, take a substance to start a very addictive, bad behavior? What do you think is the approach for the situation, especially when it's a young person and he says, "Don't worry, I can stop anytime. I can stop anytime." What's your reaction to this?
Yeah, I think when you are young, or you're a family member of a young person struggling with this problem, I always say, always make a paradigm shift from judgment to curiosity, from judgment to compassion. So whether it's the young person or their family supporting, if you're judgmental about why did you do it, what happened, others kids in school are not doing it, but you are getting addicted. So this is some of the negative labels we attach to them, or sometimes a young person themselves attach those labels. So if you're in that judgment mindset, the recovery process gets difficult. But if you're curious about the problem, like you just said, yes, I can do it, I can get out of it. Maybe I need to meet a professional, maybe I need to talk to an adult whom I trust. So if they become curious about the subject, to understand why is it happening, how it pushed them to get into this, or how can they stop it, or are there any treatment approaches available, even without going to a professional. If there's some positive behaviors that they can cultivate in order to stop, I think they will come out of it, if not easily, but gradually over time. So it's always about making that paradigm shift from judgment to curiosity on the subject, from judgment to having compassion for yourself. Like, talk to yourself in a way you would talk to a loved one. We often show that compassion for others, but we
Yeah.
forget to show it for yourself. And I always give this airline example to my clients. When there is an emergency landing, when there's a crisis, your air hostess or your pilot will always tell you one thing, one simple instruction: first wear your oxygen mask, then you help someone to wear it. Because if you don't survive, if you don't apply that compassion, you won't be able to help someone else. It's the same thing for addiction. You have to first apply that compassion on yourself, that belief that you can come out, and then others will see that progress in you.
Amazing. Now let's look at recovery from this. In your experience, what's the first part of recovery from addiction?
Having awareness on the subject. You have to understand that you are dealing with a problem. Whether it's a mental health problem, in a neurobiological problem, what is it? How is it impacting you? How is it affecting you? You have to understand, because every case of addiction is different. So that's why I always encourage people to understand the different parts of addiction, not just the biology, what is happening in your brain that is making you stick to this compulsive addictive behaviors, but also understand what is your social context, who are the people you can talk to, what are the tools available that you can access, what is the environment you're living in. So build awareness. So first step is always having awareness on the subject. Or if you're a young person, talk to someone you trust. It could be an adult. I would highly encourage not to talk to a peer, because they're of same age and they might be going through the same problem. So talk to someone, or talk to an adult you trust, you feel safe to talk to, and see if you can have access to, because a lot of tools and resources available online, and even a lot of NGOs have come out doing workshops, training. So it's available. If you want to get help, you can get the help you deserve.
When you talk about this, about when you're going through addiction and the first recovery step and you also said that you should, trust your parents or trust your loved one or guardians, but let's look at it, because really I've had people that were really addicted to substances, and during my time with a TV station back in Nigeria, I did a subject, research, and I visited a
Okay.
rehabilitation center, and I saw terrific things there. It was so bad. And when I had conversation with a few of them, and I was told that, okay, when this started, I was scared to tell my parents. I was scared to tell my loved ones. They would practically kill me. So I realized that maybe our guardians or our parents are not being safe places.
Yes.
So to that parent or guardian watching this show right now, okay, and probably in that situation, what would be your advice, your piece of advice?
Again, a very important question, and I really hope parents who cut their kids or set very harsh limits or apply the concept of tough love when they're dealing with a problem like this, stop doing that, because shaming doesn't help. It activates it activates that part of the brain that causes physical pain, and that is why they feel scared to go to their parent. So in such situation, if you're a young person and you're feeling that your parents are not the most safe place to have that dialogue and conversation, reach out to a teacher, reach out to an adult or an youth who you have seen have experienced this but have come out, or someone who is elder to you, not probably within your family but outside, who can help you. But talk, or probably just there are lots of, as I say, multiple mental health platforms where you can just go and look up for resources, or just have some 30 minutes discovery call free of charge and cost to talk to a professional. So my advice is, if you have access to that, and every school, especially in Dubai or in multiple cities, have counselors, have psychologists available in universities or schools. So if you can't talk to them, maybe your first access point is those counselors in school who understands the problem, who understands the neurobiology behind it, and might be able to help you to have that dialogue between you and your parents. So there's always when there's a way, there's always a way to change. There's always a way to get access to that right support. So if you can't talk to your parent, talk to a teacher, talk to a mentor, talk to your counselors in school or in university who might be able to help. And to your question about parents, please treat the situation sensitively, because it takes a lot of courage for a young person to come and say what they're saying, to come and reveal what they're going through. And that's your opportunity to build a connection. That's your opportunity to kind of, push them towards their first step of recovery, which is giving that compassion and letting them know, no matter what, you would be with them throughout this journey. Because recovery is a journey. It's not end game.
Okay.
It's a process. And if you can play a tiny role in that process, recovery will be much faster.
Amazing. And while we still look at recovery, what therapies can actually help people change their addictive behaviors?
There are a lot of therapies, to be honest, and under rehabilitation program, as I said, there's no one size fits approach. We take into consideration multiple. If you personally ask me, I follow a biopsychosocial model where I apply a lot of neuroplasticity approaches, where I include, cognitive behavior therapy, where I do a lot of restructuring, cognitive diffusion. These are some technical words I'm using, but which basically helps to rewire, retrain your brain. Apart from that, a lot of somatic works are done, and a lot of expressive therapies are done, which is art therapy, dance movement therapy, because they are also very helpful. One thing I think which is commonly used is the power of movement in addiction program, because movement is medicine. You move your body, you do some, push-ups and exercise or aerobic exercise or brain stimulating exercise, it always helps. So it could be multiple therapies or multiple approaches that could be used, but cognitive behavior therapy is very powerful. Somatic work or expressive therapies or any skill-based therapies that actually teaches them to say no, which retrains their brain or reprograms their brain, could be helpful in the recovery process.
Amazing. And when we still look at, recovery, I realized that something is very important, which is what they usually struggle with, relapse.
Yes.
You know, so what's your view on relapse in your experience?
Yeah, I think one of the biggest myth attached to addiction is if you relapse, you're a moral failure, or that's the end of the story, that's the end game. No. Like, we all have setbacks in life, right? Like, let's say it's an exam or a pitch or a bid. Sometimes it works, sometimes it doesn't. But does that mean we are a failure? No. We probably have not excelled in that situation, but there'll be multiple opportunities to bounce back and do better in life. And it's the same logic applied in the recovery process. A lot of people think if you relapse, that's the end of the story, there's no going back. No, actually, it's a feedback to your recovery process.
Really?
Yeah, because recovery is again a dynamic process. It's not static. If you relapse, it doesn't mean that's the end of the story. Yes, that means you have to do some tweaks, you have to do some changes, you have to apply another therapeutic or treatment approach, but that's it. It's just a feedback that you're getting. It's not the end game, it's not the end of your story. It's just a suggestion, recommendation that some of the strategies you have used might not be helpful for your case. You need to tweak it, you need to probably get better support, you need to be in a better environment. So it's just a feedback.
I've had conversation with people, and I've been in rooms where they would say that, okay, they would say, I tried my best. I tried, but it wasn't enough. So, and some persons feel like relapse is failure. All right. So, from your experience, to that person that is really struggling with this or has a loved one struggling with this and relapse have been the major issue, what would be your piece of advice?
You might have failed to tackle the symptom, or let's say it might be because in that recovery process you've only focused on removing or eradicating that behavior out of your system, but you've not focused on deeper wounds, which is your emotional pain, which is your unmet emotional or psychological needs. So my piece of advice to that person is, you might have failed in dealing with the behavior part of it, but maybe not the other facets of it. So recovery is a very wholesome process. So if you just fail the behavior part, which is, you tried, you really tried, but it relapsed, you're going back to it again, that's just one part of addiction. But let's say you've made progress in terms of meeting your emotional needs, learning new strategies to cope with emotional pain. That's also a progress you've made. So I want you to be mindful of those, progress or those small wins you've made in that treatment journey. So don't treat it as, okay, if you've just gone back, you just using that substance again, you're a failure. No. That's the part you need to work on. That's the part you probably need more help with, but you're probably improving in other parts. So just be conscious of that recovery is not just about treating the behavioral symptoms. That's why when relapse happens, people think, oh my God, I'm back to that behavior, so I'm a failure. No. Behavior-wise, you might have failed, but other parts, which is probably, changing your, coping strategies, changing your social patterns, forming, healthy routines, forming meaningful social connections. People tend to forget those progress they've made, and they don't, take into consideration into the recovery process.
Amazing. And when you talk about relapse, even when I was preparing for the show, it just gave me some flashbacks, some reflection, and I this subject is very important to me. I've seen people try to stop.
Yeah.
After months, they went back and it became worse. And I think some persons might say they didn't get the help they needed. Some persons would say, okay, what would I have done differently to help this
Yes.
person? Because let's be honest, the effects of addiction affects us, especially when we have someone that is really struggling with it. Even as a family, it can be very traumatizing. It can be very,
Absolutely.
bad, and they need help. Okay, but getting the help they need, I think that's where the problem lies. So, as a professional with over a decade of experience, because we're about to wrap up, to that person struggling with addiction right now, cocaine, any substance, marijuana, even not just substances, but even other addicted behaviors
Yes.
like pornography, like masturbation, like whatever. And these, like you did say on the show, is really affecting their productivity, affecting their life, and making their life not purposeful. What would be, your piece of advice on the need to stop, on the need to seek help, on the need to get better? What would be your piece of advice conclusively?
One simple word: remember, your brain is neuroplastic. You can program, you can change by focusing on what you want to focus on, or what do you want your brain to understand about yourself. So, your brain has this beautiful power of changing. Your brain is constantly adapting and learning. Like, if you see our experiences, you grew up in Nigeria, I was back in India, then I moved to different cities, but we have adapted. We have adapted with the culture, we've adapted with the food, the accent, like that. If recovery is also a very dynamic process, and so is addiction. You're not born with it. You learn it. So if you can learn, you can unlearn, and that's where the power of neuroplasticity comes in. You can rewire your brain, you can retrain your brain. It's programmable, and you can program it by choosing to focus on what do you want to be in future. You want to be someone stuck in the loop of addiction, or someone who's productive, creative, and fulfilling all their personal and professional aspirations. So my advice, or conclusively, I would say that do not undermine the power of neuroplasticity of your brain, because it can change in couple of minutes. It depends on what you feed. The food you're giving to your brain is your thought. If your thought focuses on positive words, affirmation, motivational quotes, inspiring thoughts, you are bound to change. You are bound to get out of that problem, no matter what it is, whether it's reliance on substance, addiction related to gambling, food, work, whatever it is, you can come out of it. So believe in the power of your brain's ability to change, brain's ability to recover, and brain's ability to rebuild your life in extraordinary ways.
Amazing, amazing, Dr. Dia. And just before we go, if there were one thing you would love to see change in society on how they approach addiction, what would it be?
I think I believe in early intervention. I would say it should start from school, as early as that, because I believe every educator should be taught, or not just educator, parents should be taught about emotional literacy. They should be taught about trauma informed responses. They should be taught about how to help their children to build boundaries, be more assertive, or say no when they have to. Because we focus so much on academic skills, we focus on life skills, and these are life skills, to make someone emotionally intelligent, to make someone be sensitive, to make someone assertive, to say no when they have to. I think these we try to develop when we become an adult, but it should start from school. So at schools, teachers, parents, educators, governments, NGOs, non-profits should come together to build more awareness on social skills that people need. Because if we can engage young people actively, they will participate with life. They will not have the need to kind of go and rely on substances to feel happy. So there need to be more safe spaces, more inclusive dialogues around this subject. And that's where they will feel more safe to challenge, more safe to talk about. Even if they slip into a problem, they know there's this safe space. There is this teacher. There are my parents who can support me, who can help me, who can drag me out of that problem. Unfortunately, we have very such less spaces where we can have that open dialogues, conversations, programs which focus on social skills, emotional literacy, and trauma informed responses. So my advice would be, If you really hope for change, it has to start early. It has to focus on community based approaches, it has to focus on early intervention in schools.
Thank you so much, Dr. Dia. It's been an amazing time and a very reflective time as well. And of course, I know you watching this episode right now. Dr. Dia dished out a lot of, nuggets, a lot of wisdom, and I think you should, share with someone out there that needs this. And also, of course, if you're addicted, you also need it. Now, that's it on today's episode of Fuse with Ken. I would say this: addiction does not start in a day, does it end in one either. But every honest conversation, every new awareness, every behavioral shift is part of the healing. If today's episode stirred something in you, let it. Sit with it. Speak about it. Change starts in moments like this small, quiet conversation, and of course, the real conversation. Thank you so much for watching, and bye for now.